Alveolus, small air sacs in the lungs where gas exchange occurs between the air and bloodstream. Oxygen is absorbed into the blood and carbon dioxide is expelled. Damage to alveoli, as seen in emphysema, can impair this process, leading to respiratory difficulties. Bronchus, the two main air passages that branch from the trachea and lead to the lungs. The bronchi carry air to the alveoli for gas exchange. Infections or blockages in the bronchus, such as in bronchitis, can hinder airflow and lung function. Alveoli, tiny, balloon-like structures at the end of the bronchi where oxygen and carbon dioxide are exchanged. Alveolar walls are thin, allowing gases to diffuse easily. Damage to these structures can cause diseases like emphysema, leading to decreased oxygen supply. Asthma, a chronic respiratory condition that causes inflammation and narrowing of the airways, leading to difficulty breathing. Symptoms include wheezing, coughing, and shortness of breath. Asthma attacks can be triggered by allergens, pollution, or respiratory infections and are treated with inhalers. Emphysema, a progressive lung disease where the alveoli are damaged, leading to reduced surface area for gas exchange. It causes shortness of breath, chronic cough, and difficulty exhaling. Emphysema is commonly caused by smoking, and there is no cure, but treatment can help manage symptoms. Hemoptysis, coughing up blood or blood-stained sputum, usually due to a respiratory condition like tuberculosis, lung cancer, or severe bronchitis. It indicates potential damage to the lungs or airways and requires medical evaluation to identify the underlying cause and prevent complications. Hemothorax, accumulation of blood in the pleural cavity, often caused by trauma, injury, or disease like lung cancer. It can lead to lung collapse, difficulty breathing, and low blood pressure. Treatment usually involves draining the blood and addressing the underlying cause. Pneumonia, an infection of the lungs causing inflammation in the alveoli, often resulting in difficulty breathing, fever, and cough. It can be caused by bacteria, viruses, or fungi. Antibiotics or antiviral drugs are used to treat bacterial pneumonia, while viral cases often resolve on their own. Tuberculosis, a bacterial infection primarily affecting the lungs, causing persistent cough, chest pain, and weight loss. It spreads through the air when an infected person coughs or sneezes. Treatment typically involves a long course of antibiotics to eliminate the bacteria from the body. Bronchoscopy, a procedure in which a flexible tube, bronchoscope, is inserted into the airways to examine the lungs and air passages. It helps diagnose lung diseases, infections, and tumors. Bronchoscopy is often used to take tissue samples or clear blocked airways. Tracheostomy, a surgical procedure that creates an opening in the trachea to allow breathing when the upper airway is blocked or compromised. It is typically performed in emergencies or for patients with chronic respiratory conditions requiring long-term ventilation support. Intubation, insertion of a tube into the trachea to maintain an open airway, commonly performed during surgery or in emergency situations like respiratory failure. It ensures that the patient can breathe while under anesthesia or when unable to breathe independently. Thoracotomy, a surgical procedure where an incision is made in the chest wall to access the lungs, heart, or other thoracic structures. It is often performed for lung cancer surgery, trauma repair, or removal of fluid from the pleural space. Atelectasis, the collapse or partial collapse of a lung or alveoli, often caused by obstruction, shallow breathing, or lung disease. It can lead to reduced oxygen levels, shortness of breath, and increased risk of pneumonia. Treatment involves addressing the underlying cause and improving lung expansion. Pleura, a double-layered membrane surrounding the lungs and lining the chest cavity. It helps reduce friction between the lungs and chest wall during breathing. Inflammation of the pleura, called pleuritis, can cause chest pain and difficulty breathing. Ventilation, the process of moving air in and out of the lungs. It is essential for oxygenating the blood and expelling carbon dioxide. Mechanical ventilation may be required for patients with respiratory failure, ensuring proper gas exchange in the body. Diaphragm, the primary muscle responsible for breathing, located beneath the lungs. It contracts and moves downward to allow the lungs to expand and fill with air. The diaphragm relaxes and moves upward during exhalation, pushing air out of the lungs. Larynx, the voice box, located at the top of the trachea, responsible for producing sound and protecting the airway during swallowing. The larynx contains vocal cords that vibrate to create speech. It also prevents food from entering the trachea during swallowing. Trachea, the windpipe, a tube that connects the larynx to the bronchi, allowing air to flow to the lungs. It is lined with cartilage rings to keep it open. Infections or obstructions in the trachea can lead to breathing difficulties and require medical intervention. Epiglottis, a flap of tissue at the base of the tongue that covers the trachea during swallowing to prevent food or liquid from entering the airways. If the epiglottis is damaged or inflamed, it can cause choking or difficulty swallowing. Pneumonia, a lung infection that causes inflammation of the alveoli, leading to symptoms like fever, cough, and difficulty breathing. It is caused by bacteria, viruses, or fungi. Antibiotics or antivirals may be required based on the type of infection. Asphyxia, a condition where the body is deprived of oxygen, leading to difficulty breathing, unconsciousness, or even death. It can result from choking, suffocation, or respiratory failure. Immediate intervention is required to restore oxygen levels and prevent brain damage or death. Endoscopic, relating to the use of an endoscope, a flexible instrument with a light and camera used to view internal organs and cavities. Endoscopy is commonly used for diagnosing conditions in the digestive, respiratory, or urinary systems without requiring invasive surgery. Lobectomy, a surgical procedure to remove a lobe of the lung, typically performed to treat lung cancer, infections, or other lung diseases. This procedure helps remove diseased tissue and can improve breathing and survival rates in certain conditions. Ventilation perfusion scan, a diagnostic imaging test used to assess the airflow, ventilation, and blood flow perfusion in the lungs. It helps diagnose pulmonary embolism, lung function, and other respiratory disorders by measuring the distribution of air and blood in the lungs.